Dr. Kahn, you have published various articles on the topic. As an experienced scientist in the realm of AMR, what is your suggestion to make the policymakers be concerned about this crisis?
Well, that's a great question. Well, policymakers are usually concerned about costs. How much do things cost? And the challenge with antimicrobial resistance is that it makes the cost of treating bacterial infections much, much more expensive. And we run the risk of losing young, healthy people to what were previously treatable infections. So you lose a lot of your healthy workforce. So that should be a concern for policymakers too. So I think the biggest way then to get their attention on the issue is how much it's going to cost society, how much it's going to cost in increased medical care. Those should be important driving concerns for them.
Thank you, Dr. Kahn. As a scientist, what do you think the biggest obstacle is in tackling AMR?
That's a very challenging question. There's many obstacles. I think one of the largest obstacles is the fact that antibiotics are a victim of their own success, and they've been termed the magic bullet. And so they've been the go-to drug for any kind of ailment. Patients demand them. Doctors are often, more than willing to prescribe them. So they're very widely used. And in fact, if you look at data across Europe and across the US, the practice of medicine is cultural. The use of antibiotics, some countries and some states use many more antibiotics than others. So it's what doctors are taught how to practice, and it's the public demand. So, for example, in Europe, the Scandinavian countries usually are the countries that use the least antibiotics, and the Mediterranean countries use the most. So there's very clearly cultural differences. Similarly, in the United States, the middle of the country, poor Appalachia, the poorer states use a lot more antibiotics than the coastal states, for example. So that needs to be addressed. That's, I think, one of the biggest challenges. I think the next question you're going to ask me is about One Health, so I'm going to save the second part of my answer for that subsequent question.
Thank you. Dr. Kahn, as of now, what should be our primary goal? Should we allocate funds to promote the development of new antimicrobials, or shall we focus on protecting the already available ones?
Well, I don't think it should be an either or. I think it ideally should be an and. We should be developing novel antimicrobials, and we should be trying to protect the antimicrobials that we already have. As I said, I'm a strong proponent of potential bacteriophage therapy. There's very little funding, at least in the United States, dedicated to developing phage therapy, minuscule fraction, which I think needs to change. There's quite a bit of funding available for developing or for trying to steward the current antimicrobials to improve antibiotic stewardship. So I'd like to see a bit more going up towards developing the novel therapeutics in addition to trying to protect the therapeutics that we currently have. There's much room for improvement in terms of our stewardship. Again, in the environment, we need to not only have stringent state-of-the-art sewage systems that address not just human waste, but animal waste too, because the studies are suggesting that animal waste is what's really driving a lot of our foodborne waterborne illnesses, not necessarily human waste, although certainly we want to make sure that there isn't raw human waste in our environment either. But we have to make sure that people just have access to very good sanitation systems, promote good hygiene. I don't want to go into other details yet because I want to save them for the next question. So, of what developing countries should do to ensure the judicial use of antimicrobials. So I'll leave it at that.
Thank you, Dr. Kahn. Developing countries like us do not have strict legislation regarding the use of antimicrobials. Could you share some future guidelines in order to ensure the judicial use of antimicrobials worldwide?
Yes, thank you for that question. Well, in 2015, the World Health Assembly adopted a global action plan on antimicrobial resistance. And then they urged all the member states to have these action plans in place by 2017. Some countries have been more productive than others, and I'll share with you a website shortly of all of these action plans. But there are a few things that the developing countries should certainly do. A number of them offer antibiotics over the counter without a physician's prescription. And I believe India is one of those countries that does allow that to occur. So when trying to curtail extra use of antibiotics, certainly making antibiotics available over the counter without a physician or veterinarian's prescription is a guarantee to make antimicrobial resistance worse. So that's one thing that developing countries should certainly do, and that's to not allow that practice to continue. The other is to ensure, improving sanitation and hygiene. As I showed you in that previous article on global estimates of fecal production, having large amounts of fecal matter in your environment increases the risk for foodborne, waterborne illnesses, increases the microbial load that your body has to endure in order to stay healthy. And so, for example, childhood stunting is a serious problem in India. Children's bodies are just expending so much energy fighting infection that they don't have as much energy for growth. So there's a number of signs, if you will, that the environment is just overly loaded with microbes. So you have kind of disrupted ecosystems. So not allowing over-the-counter antibiotics for sale, stringent sanitation and hygiene, particularly animal fecal matter, should not be widespread in the environment. Other guidelines, educating physicians, veterinarians, and educating the public on the benefits of antibiotics, but also, the risks of antibiotics, and that they can alter your microbiome, potentially increasing your risk for foodborne allergies, for autoimmune diseases, potentially for some cancers. So, there is a trade-off in antibiotic use. They are not completely without adverse effects. And of course, there's the risk of Clostridial difficile colitis. So, widespread public education, physician and veterinarian education are all extremely important activities that developing countries should implement. Thanks.
Thank you, Dr. Kahn.